Hello, everyone, and welcome. I'm Michelle Hannigan. I'm Specialty Solutions Director here at Nextgen Healthcare. Delighted to be with you here today. We've got a great topic in our ongoing peer-to-peer webinar series. As you can see, we're going to be diving into KPIs. I'm really excited about what we're going to be talking about today, an insider's look at First Care Clinic's financial success. I'll talk a little bit about that in just a moment. Before we dive in, just a bit of housekeeping. As always, your questions and comments really help inform the conversation. So I would invite you to put your comments and questions down in the question box. That's the lower right-hand corner of your screen. We do have time at the end of the webinar where we will get to as many questions and comments as we can. If we're not able to get to your question, or if you have an idea, something spins off what you hear today that you'd like to learn more about, or you'd like to suggest another webinar topic, please include your contact information, your question, and we will certainly follow up with you afterwards and would be delighted to do so. So I'm a new face to Nextgen, and many of you are used to seeing my colleague, Mike Hoffmeister, the VP of Primary Market Solutions. I'll be your MC today, along with my partner here, Mark Miranda, and I'll introduce him in just a moment. We'll be digging into this topic. So just a bit about me in terms of background. I am a family nurse practitioner by training, and I've spent the last nearly 20 years working in a federally qualified health center here in Western New York. Clinical operations is sort of my area of specialty, and spent quite a bit of time working with our CMO, our clinical teams, the nursing staff, all the folks who work day to day in the care delivery, as well as the decision making around how we learn from what we're doing and ideally get paid for what we're doing. Hence why this topic is incredibly important. Just a bit more about that. Especially now more than ever, we need to make sure that I'm saying we as FQHCs and CHCs, how are we getting paid for that hard work that we're providing day in and day out? We are mission-driven care. That is who we are, that is our identity. And we also know, I've been in many of those rooms where the conversation around no margin, no mission gets kicked around quite a bit. It's an everyday struggle, and certainly now more than ever, we are tasked with making sure that we can be as efficient, as conscientious as ever with regard to how we are doing things we need to do to get paid for that hard work the clinicians and their care teams are doing with our patients. Very important topic. So without further ado, let me introduce my colleague, Mark Miranda. He is going to facilitate our conversation today along with Brian Brady from First Care Clinic. Excited about this. Mark is our Director of Client Management here at Nextgen Healthcare. He has got a wealth of experience and background, 10 plus years in the financial marketplace, if you will, specifically with FQHCs, really working hard to help those practices maximize what they're doing, getting paid, everything from payer contracts and risk management agreements and practice management improvement flows, analysis, reporting. He's really got that solidly in place and certainly will be able to work with us today to talk a little bit more about that. So reminder again, put those questions in. And with that, I'm going to turn it over to you, Mark.
Thanks, Michelle. Thanks for that introduction. As you stated, I've been working with FQHCs for a long time, so I'm really excited to be working with Nextgen in the Nextgen RCM services department, where we do help out with FQHCs across the country with their billing and RCM services. So I'm really excited to highlight one of my favorite clients. They're all my favorite, but this one's definitely my favorite. We have here with me today, Brian Brady, CEO of First Care Clinic. Brian, are you out there?
Oh, we're doing good. Thanks so much. And thanks for having me on today, and appreciate the opportunity to share our experience with Nextgen and what we're doing. Our FQHC is about 13 years old, and we've had a lot of growth over those years, and really made a big impact in our community. We're serving, over 6,000 patients now, providing almost 20,000 encounters for those patients, and that's a big deal. It's in total, it's may not seem like a lot compared to some of the other centers, but in 12 years we've had that kind of growth, and we wonder, where were these patients being served before we were taking care of them here, and where were they accessing healthcare? Were they using the emergency room? Were they foregoing healthcare? And that's a big thing that FQHCs provide, is that access to that population who wasn't being served, and just making sure that they have the best possible health outcomes. And also, I know we're talking about financial measures today, but something we've been able to do in addition to that is, for the last 2 years, we've been in the top 10% of health centers for our quality data, and so that's something we're very proud of as well.
Very impressive, Brian. That's why we had you here today. And we do want to dive into the financial success, because obviously you have a lot of clinical success with your community, but financial also is really important. I guess what we would like to hear from you is, you had to make a decision on who to partner with your EHR and practice management system, but more importantly, you also expanded that relationship with Nextgen by hiring us to do your RCM. If you could take us through that thought process and that strategic decision-making process, and let our audience know what drove you, or what things drove you to make that call.
Sure. So we've been with Nextgen for a little over 7 years now. Before, we were with a vendor that offered an electronic health record and a billing service, and we just weren't satisfied. And one of those reasons being that their billing service wasn't as good as we would have liked, and the other reason is they didn't bring us a dental solution. It's very important, because my clinic provides medical services, behavioral health services, dental services, all under one roof, and we needed a partner that understood that, and that offered an integrated solution for all that. The other thing that was important for us was to have a vendor that could do the FQHC billing for us, because it's very specialized. There's a lot of intricacies to it, and we need a partner who is willing to work through that with us. And at the time, we put it out for bids, and Nextgen really stood out as compared to the other vendors, because they brought a fully integrated medical record with the dental solution as well. So, what was important about that to us is that the dental clinicians weren't having to look somewhere else to see what the medical clinicians were prescribing. The chart, it also shares a med list and an allergy list, and so that was all very important, that was all in one place, and we could access that across disciplines in our clinic. So very important to us. And then so we're in a rural area, and it's hard to keep the billing staff, and so somebody who could bring not only the integrated medical record, but the FQHC expertise in the billing, and is what eventually led us to select Nextgen as our vendor.
And it's led to a very long-term partnership. And what we found in this partnership is there's a lot of data that's really important to you, Brian, we've noticed. And there's a lot of data that's really financial data that's important to you for an FQHC. So I think what we can do now is kind of transition into some of your data. And what we'd love to hear is from you, your perspective on why this is important. For example, we got payment lag. Now, payment lag is really measuring the quickness of how quickly you can get paid after that claim heads out the door. And regional benchmarks show that FQHCs in your area and around your area are doing about 31 days from the day they bill before the day they get paid. Now, you're at 24 days, and that's just outstanding. You're crushing the benchmark. Love to hear from you on what First Care Clinic is doing overall with their clinicians, with your accounting department, and with your administration to make sure that you're getting paid as quickly as possible, and why that's important?
Sure, yeah. So like Michelle said, no margin, no mission, right? So we want to make sure we can take care of people, but we've got to do it in an efficient manner because we can provide the best services, but if we're not paid for them, we're not going to be here very long, right? So we want to make sure that we get credit for what we're doing first. So what we've done is we've made the charges and the billing important to our clinicians. Um, we've written in their contracts that the charges and the bills have to be in within 24 hours of them providing the service. And that's only one piece of it though. So the other piece of it is that we want to reward our clinicians for working hard. So we've got a formula that we use to establish the clinician's salary, and it's based off their charges. And so they know that those charges are important to their salary calculation. And so they want to make sure that they get those in as soon as possible and as accurate as possible. And what that does is it leads to those charges going out the door quicker on the Nextgen side after those super bills are submitted from our clinicians.
And the metrics really show it. Like on the next slide, we measure bill creation lag time. Bill creation lag time is taking two data points, data service and the day those charges are entered and billed. And as you can see, your clinicians are performing way below our target here at Nextgen is 2 days to get our clients in under 2 days. And you are absolutely smoking it. So can you share with us how you potentially maybe use these metrics that we share with you, or how you engage the clinicians to buy into this mission, and any kind of tips for our audience that might be struggling with something like this?
Yeah, so like I said, we make it important to them, make it meaningful to them because, if you just say, well, I need these charges put in as quick as possible, well, why do they care? So, obviously show them why it's important, because obviously we want to get this money in the door. But then there's also some things you can do, and another thing I'll say, just because, we use Nextgen for RCM services doesn't mean we still don't have some, billing staff on site as well, because, it's important. There's some things that we need to invest in on our end to make sure that, we're successful and to help Nextgen be successful in billing our claims. So we have what we call an accounts receivable clerk on site, and what she does is daily runs a missing charge report or a zero charge report. And if those clinicians have missed putting in those charges, she works with them, that day, if not the next day, to make sure that those get in sooner rather than later. So that's a big thing we've been able to put in. You just can't turn a blind eye to it and make sure that, and think that clinicians are turning those charges in, because there is a certain amount of monitoring that is really crucial to be successful.
Absolutely. It seems like there's a good ROI on that staff member who is a good, I guess you could say, intermediary between Nextgen and your clinicians, and provides that layer of one-on-one support. Have you found any difficulties with any type of providers that you've encountered over the years, and any kind of maybe strategies or tips maybe to help overcome anybody that might not be engaged from a clinician standpoint that you could potentially share with us?
Yeah, since we put in that the salary structure based on their charges, they're very interested in making sure that they have the right charges put in. I mean, the other thing it helps too is it helps that they're billing accurately too. And so the other thing we do is we do quarterly chart audits to make sure that the E&M levels are appropriate. And then, the other thing to think about too is it's not just your clinicians as well. It's your nurses that are also putting in, immunization charges or lab charges and things like that. And so, to kind of give those staff an incentive, we've implemented an overall bonus program for our medical staff. And it's a metric on one side of charges, and on the other side it's quality measures. And so, yes, we want to incentivize them to be productive, but we also want to make sure that we're providing good quality care. And so that's why we combine the two, and it's worked out really, really well for us.
That is very good to get everybody involved. I applaud you for that program, and I'm sure your staff also agrees as well. Skipping over to the next metric, let's go to the next slide, changing gears. Let's look at AR. So in our partnership here with Nextgen and our clients, we meet with Brian and his leadership to go over scorecards. And in this scorecard, we're looking at, your total days in AR. And as you can see, the benchmark that we have found at Nextgen for your specialty in your region be around 20 days. And you're under it with 19. Can you share with us, again, with the AR, the accounts receivable, when things go wrong and things start to age out, what's important to you, and how do you leverage not only your staff, but Nextgen to make sure that, this AR is cleaning and getting off the books?
Yeah, first of all, Mark, I want to applaud you guys for not using 30 days as the benchmark. That was always the benchmark. But in today's world, we're in an electronic world. We're not dropping claims to paper most of the time anymore. And so, we really try to be under 20 because of the way things can happen now. We've got, automated super bills, we've got payment posting when it comes back in. So, we want to make sure that, the claims are coded correctly when they go out of here. So, we do a lot of provider education on coding and helping our staff, link diagnosis codes and common pitfalls and things that we see that keep claims from going out of here right the first time. And it's a lot of work on the front end, but as you can see, it pays off when we're looking at being paid in 19 days.
Absolutely. And then also there's a lot of uniqueness around FQHC billing that our audience is very familiar with. And is there anything unique about the state that you deal with? Because Nextgen, we're in all 50 states. We have so many different FQHC clients, and every state program has a unique challenge to it. But it seems that you've overcome that in your state because you're performing significantly better than your peers in that state. If you could share with us what you've done to make things easier for your staff and also easier for us, because these claims are going out clean. So we're doing a lot less follow-up than if they were dirtier and denying. So share your success with that.
Sure. I think that goes back to, having that those few billing personnel on staff as well. Because, in Kansas, we deal with 3 different MCOs for Medicaid, plus they still have some straight Medicaid that the state deals with. And then, then we have 2 different MCOs for dental and, and then we've got the private insurance and Medicare that we're all dealing with as well. And it is staying up on the education and make sure that, those billing staff understand what the insurance companies are looking for, and then make sure that gets, relayed to the provider, because, obviously they're the ones ultimately responsible for what they're putting on that super bill. And so we want to make sure that they have that education and information as well.
Yeah, and they're very up to speed on it because as you can see with these metrics, we at Nextgen love delivering a scorecard like this because it shows the great work that the partnership is performing, not just for us, making sure you're getting paid, but also for you and in your bank account. Transitioning into the next slide. All right, let's dig into charge entry efficiency. So as Brian was talking about, he's on top of it. He's making sure that the charges are headed in as quickly as possible. But, with the CEO, you want to make sure that you can prove it. So with our waterfall, and we share this with you, Brian, what it's actually tracking is it's looking how many charges have the same data service in the month it was billed. And then it looks at payments in the same way. It's saying, where's your money coming from and what data service is it tied to? Is it the same month that the money came in, or is it 3, 4, 5 months later? So with this metric, we deliver it to Brian, and what I'd like to show is that Brian is his team, First Care Clinic, is entering 94% of their charges in the same month. Outstanding work. It's one of our top performing FQHCs. Now, Brian, I know you've already touched base on this, but maybe you could share the importance of this slide, this metric, and tracking this, and what it means to you, and how maybe you use that data internally.
Yeah, I mean, it's important for us to collect on the services we're providing as soon as we can, and this shows, that we're doing a good job to set Nextgen up for success, and then they're taking our success and working with it and making it even more successful, and getting paid in the same month, you know, for a majority of the charges, and that's important to us because, you know, that money should be sitting in our bank account, not somebody else's.
Absolutely. You paid the expense already to perform the service, and the longer you wait, the more belly up you can go and having to meet your expense and needs. So this shows, hey, listen, if we're going to work hard this month and get these charges, what's Nextgen going to do? Are they going to get it in the next month? And 84% of the time we're getting it within 30 days. So really great metric to use to the audience. If you're not tracking your charge entry performance this way, this is a great tool to utilize to see how quickly everything is coming in when you send it out. So transitioning into the next slide. All right, so we always talk about clean claim rate. How clean are these claims going out? And at Nextgen, we have our own clearinghouse that we, gather data to share with our clients. And it's all about reducing errors and reducing rework. So FCC, First Care Clinic, their clean claim rate has been consistently over 95% every single month. And that's been our goal for top performers. 95% of claims go out clean every month, prevents rework and labor. Brian, anything you want to share about this, and anything that maybe you use internally, maybe your clerks or the staff that you have on site, how do they take maybe some of these errors, and what type of programs do you have for education and reducing this rework?
Sure. Yeah. I mean, I think, we talked about how we provide that education, but I think, I'd like to use this 5% that doesn't go out clean and how we address those. Nextgen's got a very good system built in to, for their staff to send our staff messages, ask for information. We can return that information. And then the bigger thing is, yeah, we're missing those 5%, but how quickly can we get those turned around? And, with that communication tool in there, and I think they call it the work log. We can track that, we can show what's been done, we can provide that documentation, and then get that last 5% out the door so we can get paid.
Absolutely, and you're right. The more organized those reworks are, the better you can take action on. And we put them in different buckets for you. Maybe it's a coding, or maybe it has something to do with patient registration. And Brian's team does a really great job of organizing it, taking action, whether they need to retrain somebody or putting another training program. His team is always on top of it. And as you can see with their AR numbers and payment lag, it doesn't take them very long to clean this up. So Brian, you're a great client. I wish you're successful. You make my job easy. So I'll take a lot of the credit that you would give me, but your team is doing really, really great. We thank you for opening up and letting us know more about what First Care Clinic is doing to perform on the top of their game year after year. Transitioning to the other slide, I think we're coming to the end of our presentation here. And I'm going to turn it back to Michelle. Michelle, you heard it from him. First Care Clinic's doing great. What do you think?
Yeah, I got to say, I'm pretty impressed. I'm writing down tons of notes, not to mention, I'm sure we're going to get to some of these questions here. So I want to add my thanks, Brian, because this was really educational. And one of the questions that I want to hone in on is sort of under the topic of change management, if you will, because Mark, he really, got right to this with the questions around clinicians and clinician buy-in and that mantra of no margin, no mission. I lived that life of having a foot in both worlds of, the people who are seeing the patients and, as we affectionately would say, the bean counters who are in the back office, right? Making sure that we're getting paid. So whenever you're a clinic or any place is looking to implement a new strategy, pick a new EMR vendor or change workflow, there's a lot that has to be unpacked with regard to change management. So specifically, when you look at your relationship with Nextgen and the partnership that you were able to build, maybe you could talk with us a little bit about 7 years with Nextgen, you started out, what made the difference in terms of working through the changes that were necessary to get you to a place where, for example, you've got now your clinicians really on board, your support staff on board. I know you talked about the incentives, but in that very beginning, when you were building that relationship with Nextgen, how did you really address that, the need for change?
Well, this relationship has been good and it's been great for our clinic. And I'd like to say that I'm really smart and take credit for all of that, but it was with our other vendor, it was very clear that something was lacking and staff were not satisfied. And so, obviously we make sure we listen to our staff, make sure they have the tools they need to do their job. And like I said, Nextgen presented that for us as a partner, as a vendor who brought the full gamut of solutions to the table. And I'm not saying that it's always been easy, and we've worked through some things, but we've gotten to where we are because we had a valued partner like Nextgen willing to work with us and work through our problems to get to solutions that deliver results like this.
Mm-hmm. Yeah. Thank you, Brian, because you touch on something that I think is critically important and has been for many years, is the partnerships that we can have, we as FQHCs, with any of the vendors we work with, is so important to us being able to show up day in and day out for that mission-driven care. So one of the questions we have is, again, related to this. From the time you went live with Nextgen in this RCM partnership, how long did it take for you to see those changes in those KPIs, whether it was the AR or the clean claims?
I don't have an exact answer on that, but I would say it took us a couple years to get everything settled in and get to where we understood what we needed to do to be successful, what we needed to do to help Nextgen be successful, and then it really took off from there, and it has continued to improve over those next 5 years.
All right, terrific. Thank you for that. And one of the other questions we have is around incorporating patients or sort of the voice of the patient, the voice of the customer into the changes that you've made. If there's any impact on patients that they would notice, how did you integrate those, the patient's voice?
So the one thing that we did get when we moved to Nextgen was the patient portal. We didn't have that with our previous vendor, and so patients wanted a way to communicate with us, to be able to I guess have a voice in their care, and to see the care that was being provided. And so with Nextgen and then delivering that portal was also a huge piece of us selecting Nextgen as a vendor as well.
Okay, terrific. Thank you. Another question about workflows. Did you work with Nextgen or did you do it yourself in developing any workflows that would help support the clinician care teams, for example, anything that might have helped them with getting those charges entered, whether it was the nursing staff or the clinician staff?
Yeah, definitely. During the implementation, Nextgen presented us with best practices, and so we use those as a baseline, and then modify those to fit our environment. One piece we haven't talked about too is what also contributes to a clean claim going out is your front office.
Mm.
And Nextgen really did help us out, and that's one of the things we really like in Nextgen. Is the workflows that it steps the front office through, and you can really customize that and make sure that your front office pay attention to certain things to make sure that demographics are correct and insurance ID numbers are correct, and the things that nobody thinks about that create errors in claims all the time. And we've also implemented a incentive program for our front office as well, because we understand the part that they play is very critical in our success.
I couldn't agree more. My own 2 cents into that topic is there's often a lot of focus put on clinician incentive, rightly so. Clinicians, of course, being the ones who carry the significant burden of providing that care to patients. However, they will be the first ones to tell you, I know this firsthand, they don't do it alone. They would not be able to do their jobs without everyone, nurses and front desk. And I can't tell you how many clinicians have said to me over my nearly 20 years, the front desk can make or break my day, Michelle. The front desk will make or break my day. So I consider what you're talking about truly to be best practice. So another question related to the work that you did around contracting and the contracts with the clinicians and the incentives. Did you come up with that on your own, or did you work with someone, an outside entity, to help you, figure out what that would be?
No, so I mean, it's not a new concept. I mean, it's used in private practice all the time. I think where we get lost in FQHCs sometimes is it's not running them like a business.
Mm.
That's exactly what we're here to do. We're here to run a business. What we do with those profits is the difference between private practice and an FQHC. In our town, we compete with private practices, we compete with the hospital for staff, and so if we're not competitive and running it like a business, we lose.
So well said. So well said. Thank you for that, Brian. And my own kind of last question, as we're running close on time here, and I want to be respectful of your time, is as you think about this current era we're in, where we're post-pandemic, or it's some version of post-pandemic, and HRSA is certainly talking about the importance and significance of FQHCs and sustainability. We know that the FQHCs provide the best value. I realize I'm preaching to the choir here, but nobody does what we do better. Social determinants of health, those drivers of health. So as we think about, as you've talked about, financial success and revenue cycle management and no margin, no mission, help us and our audience think about how important that is with regard to future sustainability. Particularly as we come out of this, pandemic time.
Sure. Yeah, I think, one of the things that we've done at our clinic that we're most proud of is, this pandemic's been, it's created a lot of challenges for everyone, but healthcare providers in particular. And one of the things we're most proud of is that our quality of care stood up over that year. And even though we had these different challenges, we didn't waver from that. And I think that's one thing that FQHCs can brag about going forward is the quality of care. And, we keep hearing this value-based care, and it's coming. Well, but FQHCs have been doing that for a long time.
Mm-hmm.
And, we're there, we're ready, and you know, we're ready for the rest of the medical community to come along because we know how to do it.
All I can say is amen to that. I couldn't agree more. What a great place to sort of put a bow on our conversation today. Brian, it's been such a delight listening to your journey, sharing your insights, things you've learned. So I really want to thank you for the time you've taken to share with us and the audience today. Mark, goes without saying, your thanks, our thanks to you as well, leading this conversation. Clearly, you know your stuff, and the two of you have got a dynamic partnership going on that is certainly working well for the success of First Care Clinic. So our thanks to you both.
Thank you.
If we didn't get to your question, we will be sure to follow up with you. Again, a reminder to include your contact information. If you heard something that you liked and it made you think of something else, go ahead and put that idea in the question box, and we'd be delighted to think about other topics related to this that are important to you. So with that, thank you all, and to be continued.